Healthier Together. Sponsored by Regents Blue Cross Blue Shield of Oregon.
We were able to get the smallest known skin cancer biopsied and removed without any consequence to that patient other than a little tiny scar. So amazing.
OHSU doctors are now in the Guinness Book of World Records. May is National Skin Cancer Melanoma Awareness Month, and today is Check Your Skin Day in Oregon. And Brittany's here with this Healthier Together. That sounds incredible, this research.
Absolutely amazing. And Ashley, well, making it into the record books is very cool. The team at OHSU says they just hope it encourages more people to do those monthly skin checks.
The fact is, it's the one cancer that you can really see yourself. Right? All it takes, I think we could cause the death rates due to melanoma to plummet if all we did was look.
Dr. Sancy Leachman is passionate about skin cancer prevention and awareness, and for good reason.
Catching it early is life-saving, literally life-saving. If you can catch it early when it's at that thin stage before it's had a chance to spread anywhere else, you're gonna be fine.
OHSU's War on Melanoma campaign aims to empower you to check your skin for warnings of skin cancer.
The melanoma is also probably one of the most aggressive cancers that humans experience.
Leachman is the director of the OHSU Knight Cancer Institute's melanoma program. She's also part of the team at Oregon Health and Science University that's now in the Guinness World Record books for finding and verifying the smallest melanoma ever recorded. It measured in at 0.65 millimeters. That's 0.025 inches, or about the size of a skin pore.
No, the record is a great thing, but that's not really what we're about, right? Really what we're about is making sure that we catch things as early as we can so that we can prevent people from dying of melanoma.
So how did they catch a spot almost invisible to the naked eye?
And this actually sticks directly to the skin.
The answer? State-of-the-art non-invasive technology called in vivo confocal microscopy.
Each individual cells.
It's a handheld microscope placed on the top of the skin that visualizes the cells underneath, giving physicians the ability to see those cells without having to cut into a patient's skin.
And you can see at the cellular level. You can see those individual cells, and you can say, oh, well, those cells look fine. That doesn't need a biopsy.
And if something is concerning, then it can be biopsied. And if it's melanoma, caught early enough, it can be removed.
But what's great is that we're getting better and better and better through technology at being able to identify the ones that are bad and the ones that aren't bad so that we can make the right diagnosis earlier and sometimes now without having to cut. So it's pretty cool.
But let's go back a step, because there's a way to take action about a concerning mole or growth even before you get into the doctor's office. It starts with your smartphone. Yep, you can take a photo of it on your phone and, in many cases, send it to the dermatologist or physician to see if it needs a closer look. And now there's a smartphone attachment that takes it a step further.
Put a little drop of oil on the spot that you want to look at. We have a program that is a SCLIP program. It's a little clip-on dermatoscope that you can then put on your phone and take another picture. But now it's a close-up picture with magnification, with special lighting that you can actually see deeper into the skin, and you can tell more about whether that mole is concerning or not. And that can then be sent by the phone to the dermatologist to look at. So you can't see the individual cells, but you can see that there are a cluster of those cells that make pigment.
You can actually take one out on loan from the dermatologists at OHSU. You can also buy it online.
That's all within normal. If you look, it's almost identical and symmetric each way you go.
So what exactly are you looking for when doing a skin check? Which, by the way, you should be doing at least once a month.
And so if you see a part of a mole that's growing differently than the rest of the mole, that's a huge red flag, and you need to get in immediately.
Remember your ABCDEs. A is for asymmetry, something that's not the same on both sides. B is for border irregularity. C is for color, more than one color, dark black, or a color that includes brown, red, or blue. D is for diameter, something bigger than a pencil eraser, about 6 millimeters. And E is for evolution.
I think it's probably the most important one, because what it's talking about is something that's changing. something that's either new, that you've never seen on your skin before, that looks like it could be a mole that's an unusual one, or something that's changing, a mole that's already there or a spot that's already there that is now changing.
Leachman says it's all about getting proactive about your health, checking for changes in your skin, and reaching out to your physician when you think something might be off.
And so the goal of the campaign is really to increase awareness, to make sure that everyone, no matter who they are and what they're doing, at some point looks at their skin and makes sure they don't have anything that looks dangerous on it.
All right, so good information there. Also today, Check Your Skin Day. It's really important that we do that for ourselves. But Brittany, there's also another way that people can raise awareness here.
Yeah, and it's going to be fun too. This weekend, Sunday, May 21st, the Steps Against Melanoma Walk is happening in 5 cities all across Oregon. That includes Portland and Astoria. We've got details on that and more great resources like tips for sun protection, as well as steps for how to do a proper skin check. You can find it at kgw.com/healthiertogether.
All right, thanks, Brittany.